We're on your side tonight talking about a new chapter for frontline healthcare workers, and they're coming from former members of our armed forces. Northeastern University here in Charlotte has accelerated its nursing program to help veterans earn their degrees to enter the medical field. And it really comes at a critical time. Taking a closer look at the healthcare sector tonight, $20 billion is poured into the regional economy. The Charlotte region has seen a 20% growth in the healthcare sector since 2010. And skilled healthcare workers, they're precious. Over the next 5 years, the U.S. is going to need more than 1 million nurses to meet demand. WBTV photojournalist Gregory Simpson brings us the story.
I joined the Army. I've been in for about 6 years now. I've been a medical officer the entire time. I was the commander of a forward surgical team. We were the Special Forces medical and surgical asset. So we got activated to go to Afghanistan in 2020. We were there for roughly about a year. I had a 25-man team comprising of doctors, surgeons, nurses, and medics, and we were spread out all throughout Afghanistan, providing that surgical coverage for those Green Berets. I've always had a penchant for trying to help people, and especially trying to make their lives a little bit better. And in being overseas and being in that medical capacity, I have seen people at their absolute worst when they needed help the most. And it was so rewarding to be able to be a part of that, to make them better and to make sure that they got home to see their loved ones. And I want to be able to do that every day. As soon as I got back from overseas, I decided that, hey, I need to actually make some moves here and do what I've been trying to do for a while. So I applied to this nursing program.
Northeastern University is a global university, and our campus here in Charlotte was the first of the global campuses. It was established in 2011, and we are anchored by our Center for Health Sciences. We have the CAVS program, which is our Center for Advancement for Veterans and Service Members, which supports their journey from the military into traditional life or adding to their academic career. Have established an accelerated Bachelor's of Nursing program in which students with a prior baccalaureate degree can actually earn a nursing degree in 16 months. It's an accelerated track, and it allows them to apply their experience, such as experience in the military, to be able to further that education into health sciences and life sciences. The United States and actually the globe is in the worst nursing shortage that we've had in a very long time. The AONL predicts that there's a 200,000 to 400,000 shortage that is predicted in the U.S. alone. And of that, Charlotte and North Carolina is expected to have a shortage of 16,000 nurses by 2030. And part of that is because of the serious COVID epidemic, but also just many of our nurses are aging out. The population is changing. And so we're looking for ways that we can engage students into the field of nursing, which is very lucrative and very open to all different types of nursing. Military personnel often have skill sets and trainings that are very applicable to moving into health science or life science. Oftentimes they have experience in the field and real-world experience that is able to help them to learn the educational requirements quicker, assimilate faster.
This has been such an incredible experience of just being engrossed in this environment, and despite all of the scut work that we have to do, those night shifts that I'm at the hospital, I'm like, yep, I'm where I need to be. I diagnosed with PTSD, depression, anxiety, insomnia. I'm 31, but my body feels like it's 82. You know, it's kind of an occupational hazard. And the good thing about being in this program with other veterans is that we have the same experiences and we can rely on each other. And one thing that most people miss when they come out of the military is that bond and is that sense of camaraderie. And with Northeastern's extensive military outreach, you still have some of that. Some of my closest friends in this program are also veterans, and we get to talk to each other about how we're feeling. We get to talk to each other about, hey, I've noticed that this was different. This is how we used to do it. how can we adapt, how can we be better. And it's really finding those people that will help you, and also finding those people that will tell you, hey, something is kind of going on, let's talk about it, or I think you need to go talk to somebody about it. And it's amazing having those people here.
Our heroes still willing to serve. Incredible.